So guys, this is a very recent update and very important update which I want to tell you, which is very highly tended of questions for your central exams, and everybody should be knowing this. Okay, so let's quickly take a review of Robbins 10th updates and all the Robbins 10th and all the new updates which have been updated in the field of apoptosis. Okay, or I should say in all the programmed cell deaths. Okay, so if you have seen my earlier videos, I've told you that not only apoptosis is a programmed cell death, but there are other types of programmed cell death also, like pyroptosis, like necroptosis, okay, like ferroptosis. In fact, I had put leaderboard questions in ferroptosis, if you remember, like netosis. Okay, so all these are various types of programmed cell deaths which you should be knowing. Okay, and what are the updates in this is one thing which everybody should be very clear. So starting with apoptosis first. Okay, so when I talk about apoptosis, everybody knows we at that time we talked about that there are basically sensors and mediators of apoptosis, isn't it? So sensors and mediators of apoptosis. Okay, so at that time itself I told you that normally if I define a cell, and I told you that time itself, I hope you remember that, I'm not forgotten that. So at that time itself I told you, okay, if I draw any cell, okay, so let me draw a cell here. Okay, so if I draw any cell here, okay, I'm going to just highlight it for you. If I draw any cell here, so every cell has some domains on it. Okay, some domains on it. So I told you that these domains which are present in cell are called as BH domains, that is BCL2 homologous domains. Okay, and that time itself I told you that we have 4 BH domains. Okay, so 1, 2, 3 and 4. So we have 4 BH domain. So any molecule that has 4 BH domain, all the 4 BH domain, okay, that molecule at that time, okay, we defined as mediators. Which mediators? Anti-apoptotic mediators. So I told you that time itself that mediators of apoptosis can be of two types, either anti-apoptosis or pro-apoptotic mediators. Okay, pro-apoptotic mediators. Okay, so before going to the change, let's see what we already know. So when we talked about apoptosis, I told earlier also, I told there are sensors and mediators can be anti-apoptotic or pro-apoptotic. Okay, so in anti-apoptotic mediators, we all know that the most important anti-apoptotic mediator here is BCL2, isn't it? Or it is BCLXL, or it is MCL1. So out of these three, most important anti-apoptotic mediator is BCL2. So any anti-apoptotic mediator is an anti-apoptotic mediator, okay, because structurally it contains all the 4 BH domains. So they contain all the 4 BH domains structurally. That is why these molecules are also known as BH1 to 4 molecules. So what are these molecules called as? BH1 to 4 molecules. And this is same as earlier. Okay, so there was no change in it. Okay, so what is the change? The change that came was in pro-apoptotic mediator. So in pro-apoptotic mediator, they found that the structure of pro-apoptotic mediator is a little different from anti-apoptotic mediator, in that pro-apoptotic mediator have only 3 BH domains. So instead of 4, they have first, second and third BH domain. So they have 1, 2 and 3 BH domain, and the fourth domain is missing. That is why they were called as BH1 to 3 molecules. What were they called as? BH1 to 3 molecules. So these molecules were your BACs and BAC. I hope you remember, BAC's back channel form a tunnel through which cytochrome C comes out. And that time I told you that these are called pro-apoptotic mediators. Okay, so remember the update here and the change here. So any pro-apoptotic mediator, that is BACs and BAC, instead of 4 has only 3 BH domains now. That is why they are called as BH1 to 3 molecule. Whereas Anti-apoptotic mediators are called BH1 to 4 molecule. So that's a very important change. Okay, so remember, out of them, name itself is BCl2 homologous, so they have all the 4 domains. Whereas pro-apoptotic mediators have 1 domain less, so they are only BH1 to 3 domain. Now, what about sensors of apoptosis? So there's not much change. It's exactly same as earlier. Okay, so this I had already told you. There's no change in it. So sensors have only one BH domain. So I've already told you this earlier in my lecture. So they have only one BH domain. That is the third BH domain, and that is why they are called as BH3 molecules. So BH3 molecules, because they have only one BH molecule, that is the third BH molecule, and they are called BH3 molecules. So these molecules are called sensors of apoptosis. And which are the sensors of apoptosis we have? So remember, I hope you remember this: BAD, BID, BIM, PUMA and NOXA. Okay, so these are sensors of apoptosis, and sensors of apoptosis have only one BH domain, and that is why they are called BH3 molecule. So what did you learn from this chart today? So you learned that whenever we are talking about mediators or sensors, sensors have only one BH molecule, that is the third one, that is why they are called BH3 molecules. Anti-apoptotic molecule have all the 4 BH domains, okay, BH1, 2, 3, 4, so they are called BH1 to 4 molecules, whereas pro-apoptotic molecules like back and back have, okay, they have only 3 BH domain, that is 1, 2, 3, so they are pro-apoptotic mediator. So that's the first update that came in apoptosis, which you should remember. Now coming to the second update. Okay, so there was a term which is introduced. This is called Efferocytosis. Okay, so what is this term called? Efferocytosis. So you know what is the meaning of Ephro in Latin? To take the dead body to the grave. To take the dead body to the grave. So now you know, whenever the cell, apoptotic cell dies, okay, so whenever this is, let's say this is the apoptotic cell and it has died, okay, so this is the dead apoptotic cell, okay, so it has formed the apoptotic body, so this is a dead apoptotic cell. So now macrophages come to eat up these apoptotic body. So how do they recognize that this is a dead cell? I hope you remember, we have already told you that these dead cells have some eat me signals. Okay, they have some eat me signals. Okay, which majority of the time is phosphatidylserine. But I told you C1Q or thrombospondin. Okay, are also eat me signals. Okay, so phosphatidylserine, C1Q, thrombospondins, they are also eat me signals. So whenever these cells have these eat me signals, it is very easy for macrophages to identify it. Now immediately these macrophages eat up this dead apoptotic cell. Now this mechanism is very fast. Okay, so it occurs very fast. That's the first point about efferocytosis. Second is, whenever it engulfs this dead cell, it usually engulfs it in a water-filled sac. Okay, it's a fluidic sac basically. So it engulfs this cell in a water-filled sac like this. Okay, so that its membrane is not damaged. Okay, so if you put something in water, it will not get damaged. No, so this process resembles macropinocytosis. Okay, so this mechanism resembles, okay, macropinocytosis. Okay, so this mechanism resembles macropinocytosis. As soon as this macropinocytic vacuole is formed, so this vacuole here is called ephrosome. Okay, just like phagosome, this is called ephrosome. Okay, so in this ephrosome, the dead cell is there. As soon as this ephrosome is formed, it further goes and activate anti-inflammatory mediators. It goes and activate anti-inflammatory mediators. It goes and activates anti-inflammatory mediators that will suppress the inflammation. and that is why membranes are not damaged and there is no inflammation in apoptosis. So it goes and activate anti-inflammatory mediators. Okay, so that's how efferocytosis occurs. So why is this important? See, there's no use of studying pathology if you don't study diseases with it. Okay, so they found that whenever there is defect in the formation of efferosome, that is this fluid filled sac which can contain this dead cell, is not properly formed, then what can happen is these anti-inflammatory mediators will not be released and it can cause various autoimmune diseases. So they have associated it with SLE and also with bronchiectasis. Okay, and some people even say cystic fibrosis also have defect in efferosome formation. So this is just study which is going on, even rheumatoid arthritis. So there are a lot of studies going on in this and they are still studying how this happens. Okay, so whenever there is a defective efferosome formation, this can lead to some autoimmune diseases like SLE, rheumatoid arthritis. It can lead to cystic fibrosis and bronchiectasis. So there is a lot of study going on this. Okay, so this mechanism which everybody should be clear is efferocytosis. That's a unique mechanism by which the apoptotic cells, dead cells, are killed up. So you should remember the eat me signals through which these macrophages identify it. And you should remember the mechanism is efferocytosis. Because why it is given a different name? Because this is not phagocytosis, it's like a pinocytosis. Okay, that is why it has been given a different name. You should remember this. Okay, yes. Okay, now let's come to the third update. Third update is about the programmed cell deaths. Okay, so third updates are about programmed cell deaths. I hope everybody knows that whenever I studied, I taught you apoptosis. At that time I told you that there is a molecule called as FLIP1. Okay, which inhibits the activation of caspase 8. So now they found, I hope everybody remembers this mechanism, that every cell has a receptor. Okay, so this is like TNF receptor or FAST receptors. Here majority we have TNF receptors. So whenever TNF receptors are activated, so this is an extrinsic pathway of apoptosis. So we are talking about which pathway of apoptosis? Extrinsic pathway of apoptosis. So whenever I'm talking about extrinsic pathway of apoptosis, you all know that it is activated through receptors. So we have two receptors here, TNF receptor 1 and FAST receptor. So whenever these are activated, this immediately goes and activates its death domain. Okay, it immediately goes and activates FAST receptors or TNF receptors. So they'll go and activate their death domains. Okay, so these so if this is a FAST receptor, I told you. Okay, so this can be FAST receptor or TNF receptor, and they go and activate FAST associated death domain or TNF related death domains, and once they are activated, they will go and activate caspase 8. I hope everybody remembers this about extrinsic pathway. Then I told you about a molecule called FLIP1, okay, which inhibits the formation of caspase 8. So how does it do so? It was explained recently. That is, it stops the interaction of TNF receptor with death domain. So this molecule called FLIP1, how does it act is, it blocks the interaction between the receptor and the death domain, and that's how it acts. Now, I hope everybody knows that whenever caspase 8 is not activated, okay, this leads to a pathway called necroptosis. Okay, this also, again, this is update number 4, where I told you that necroptosis morphologically looks like necrosis and mechanically, okay, mechanically it looks like apoptosis. So morphologically it looks like necrosis, okay, and mechanically it resembles apoptosis, but it is caspase independent, obviously, because caspase 8 activation is blocked in this. So now let's see what happens here in necroptosis. What is the recent update that has been given? So first update is that this pathway is majoritarily stimulated by extrinsic pathway, that is TNF related 1, okay, is mostly triggered in necroptosis. Second, obviously you all know caspase 8 is not activated. I hope you remember my dog example. So this is the face of the dog I told you, and this dog has 2 ears, isn't it? So what were the 2 ears? Do you remember the 2 ears of this dog? So this was rip 1 and rip 3. Okay, so the rip 1 and rip 3. So now they have said it is actually rip kinase 1 and rip kinase 3. So we have here rip, okay, rip kinase 1. Okay, so let's understand what is rip. Receptor interacting protein kinase 1. So whenever due to any cause caspase 8 is not activated, then RIP1 kinase and RIP3 kinase basically take over the function. Okay, so what are they? Receptor interacting protein, that is RIP1 kinase and RIP3 kinase take over the function. Okay, now what happens when this RIP3 kinase is activated? Once this RIP3 kinase is activated, there is a very unique phenomena which occurs. Okay, there is a protein called MLKL. Okay, MLKL. So this protein is normally present in the plasma membrane. Okay, so whenever this RIP kinase 3 is activated, this causes, okay, this start forming oligomers of MLKL. Okay, so MLKL oligomers start forming. So when the oligomers of MLKL start forming, it separates from the membrane and comes into the cytoplasm. Okay, so once the RIP kinase 3 is activated, it will immediately sequester or release the MLKL from the plasma membrane, and it will start oligomerization. Okay, it will start polymerization of this, and then the lot of oligomers of MLKL will be formed. Once the oligomers are formed, it will separate from the membrane and come to the cytoplasm. So once it comes into the cytoplasm, now it has the power of causing membrane damage. So when I taught you pyroptosis, necroptosis, okay, in necroptosis I told you at that time that membrane damage is seen in necroptosis, and that is why it resembles necrosis. So there's a lot of inflammation which is occurring. Okay, so morphologically you will be able to see membrane damage, lot of inflammation and all that. So we didn't knew this pathway in between, that how does the membrane damage occurs in necroptosis. Now they have explained that this is how membrane damage occurs in necrosis. Are you clear with this? Yes. So now look at this diagram. Okay, so what we have started. So here the most important trigger is by TNF receptor 1. It activates RIP kinase. Okay, so RIP kinase 1 and 3 is there. Most important RIP3 kinase. It activates MLKL. It causes, so function of kinases, all of you know, I've taught you so many times, is phosphorylation. So it phosphorylates MLKL and causes oligomer formation. So it separates from the membrane, come to the cytoplasm and causes membrane damage. That's a very typical phenomena which is explained in necroptosis. Okay, and everybody should be knowing that necroptosis morphologically resembles necrosis. Okay, but mechanically it resembles apoptosis. However, this apoptosis is caspase independent. Okay, so this is caspase independent apoptosis, and that is why I have already told you many times when they ask you caspase independent apoptosis, your answer should be necroptosis, or programmed necrosis if somebody asks you. Programmed necrosis if somebody asks you, that is also necroptosis. So that is your necroptosis, which everybody should know. That's an update in necroptosis. Everybody clear with this? Yes. Okay, so now let's come to the fifth update. Okay, so fifth update here is, okay, so everybody clear with this? Yes, necroptosis. Now let's come to the fifth update. Is another programmed cell death, that is pyroptosis. Okay, So not much change in pyroptosis. Only thing you all know that whenever the node-like receptors are activated, it activates inflammasome. Okay, inflammasome contains adapter proteins. Okay, and they contains molecules that can go and activate your caspase 1 predominantly. Caspase 1 actually is interleukin 1b converting, okay, molecule. So it has power of interleukin 1 converting enzyme. It is HN1 beta converting enzyme. So it changes pro interleukin 1 to interleukin 1. This interleukin 1 causes pyrexia or fever. That is why the name of this is pyroptosis. That is apoptosis, which is associated with pyrexia. So main cause of pyrexia in pyroptosis is interleukin 1. So it contains a lot of adapter proteins and it contains caspase 1. Okay, caspase 1 is nothing but interleukin 1 converting enzyme. So what's the recent update? Apart from caspase 1, recently they told that caspase 4 and caspase 5 are also involved in pyroptosis. So they introduced caspase 4 and caspase 5 also in pyroptosis. So to make a gist of it, okay, so I'm just going to make a gist of it. Okay, so to make a gist of it, let's see what all caspases we have studied. Okay, so I'm going to go alphabetically. 1, 3, 4, 5, okay, 6, 7, okay, 8, 9, okay. So let's start one by one. Caspase 1 is basically involved in your pyroptosis along with 4 and 5, okay. Next, caspase 3, 6 and 7 are executionary caspases. Out of all of them, the most important executionary caspases, caspase 3 is the most important executionary caspases. Okay? Okay, so coming to caspase 8 is a caspase, initiator caspase of extrinsic pathway. Initiator caspase of extrinsic pathway. Okay, this is also initiator caspase of extrinsic pathway. Okay, but we already know that this is a predominant extrinsic pathway caspase in humans. Now caspase 9, when I'm talking about, caspase 9 is an initiator caspase of intrinsic pathway. So this is all the type of apoptosis, and you should know caspase independent apoptosis is your necroptosis. Okay, necroptosis. Okay, apart from that, remember caspase 11 is also involved in pyroptosis. So it's 1 and 11 in pyroptosis. Okay, so 1 and 11 in pyroptosis. So that's the list of complete caspases which you should know, and I hope you will remember that caspase is nothing but it is a cysteine protease which cleaves after aspartic acid. That is why the name was caspase. So it's a cystic protease which cleaves after aspartic acid. Okay, so these are the type of caspases which everybody should be clear. Now let's come to the 7th important update. It is ferroptosis. Okay, so this also we have talked about so many times. Ferroptosis, name itself says ferroptosis, apoptosis which is induced by ferrous, iron. Okay, so whenever in the cell the iron content increases, okay, so remember I hope everybody knows that Fenton's reaction is one of the important reaction where Fe2 plus is very important for forming free radicals, okay? And one of the most potent free radical of the body is OH ions. Very important free radical of the body is OH ions. So therefore, iron is a very important molecule that has a power of creating a lot of free radicals in the body. Especially with the Fenton's reaction, it creates OH, which is the most potent free radical. So to counter these free radicals, we have antioxidants. And one of the most important antioxidant which can, counter this, okay, iron containing free radicals is glutathione peroxidase. Okay, so very important antioxidant which deals with this iron forming free radicals are glutathione peroxidase. So now, especially they said glutathione peroxidase 4 is the most important, okay, antioxidant which combats with the free radicals formed by the iron. Okay, so now what happens is, when due to any cause this antioxidant system is not working, okay, so glutathione peroxidase is not properly working, so obviously there's no GSH, there's no GPX4. So this is not working, and the iron content in the cell starts increasing, and there is no antioxidant to counter it. So there will be lot of reactive oxygen species which will be formed. So these reactive oxygen species will go and cause lipid peroxidation. Okay, will cause injury of the cell and cause lipid peroxidation, that is membrane damages. So it will cause lipid peroxidation. Not only that, okay, so these will typically cause loss of crista of the mitochondria. It causes loss of cristae of the mitochondria. Okay, loss of cristae of the mitochondria, and even the mitochondrial membrane damages. Okay, mitochondrial membrane damages. So this mechanism is basically explained by ferroptosis. Why it is given name as ferroptosis? Because if you reduce the concentration of iron in the cell, so if you start decreasing the concentration of iron in the cell, the injury also decreases. So this mechanism is ferroptosis. Okay, so what did you learn? You learned that iron is a very important molecule which helps in forming free radicals in the body, but it is usually countered by antioxidant systems of the body, which is usually GPX4. This is nothing but glutathione peroxidase. Okay, whenever the iron content becomes excessive, okay, and there is loss of antioxidant systems of the body, this excess iron can cause lipid peroxidation. Not only that, it can cause accumulation of these free radicals. They can cause damage to the mitochondrial cristae and damage of the mitochondrial membrane. Such kind of damage is called ferroptosis, and this damage can be reduced by decreasing the iron content of the cell. Do you understand that? So these are some of the very, very important updates in the programmed cell death. Okay, in the programmed cell death, which everybody has to remember. Okay, Now, what is the one of the research update which I am going to tell you, which is going on and can be asked in your central exams, especially in your JIPMER exams. Okay, so research update recently is that they have identified a molecule called NRF2. Okay, NRF2, which you have already studied in a lot of places in pathology. Okay, so this is nuclear erythroid, okay, related factor 2, NRF2. So these molecules NRF2 are very important molecules. It is said that these molecules are basically induced by GPX4. Glutathione peroxidase induces NRF2, which protects the cell. which protects the cell from ferroptosis. It protects the cell from, ferroptosis. So that is the final trigger pathway. Okay, so they said, what is this? NRF2 is the final trigger molecule which protects the cell from ferroptosis. Okay, so therefore when GPX4 is lost, there's loss of NRF2, so ferroptosis occurs. So this is the final common pathway. It's not given in your Robbins, but it is a lot of research is going on this factor. Okay, because they are saying that ferroptosis is one of the key mechanisms for dealing with cancers. Okay, so they said if you increase the iron concentration in the cancer cells, what is going to happen? Obviously this iron concentration will increase and it will immediately accumulate in the mitochondria. It will cause lipid peroxidation, it will cause damage to the mitochondrial cristae. So what will happen to that cell? It will undergo apoptosis. So the cancer cells will start dying by themselves. So that is why they said, so let's make some drugs which can inhibit NRF2. So if we inhibit NRF2 automatically, or if we increase the iron content, okay, and inhibit the NRF2, automatically the cell will undergo ferroptosis, and that is how the cancer cells can be killed. Lot of research is going on this mechanism. Okay, so anyhow, that's just a research point. Okay, so that is about ferroptosis, and I'm sure everybody will be very clear with it. So these are the recent updates in the apoptosis, in all the programmed cell deaths, that everybody should be very clear. Right? Okay, I hope you have understood this and you'll be doing good in this. Okay, right. So very tentative question in your central exams, in your needs, and in your basically it is also increasing your knowledge. Okay, so that's how we are planning treatments with the cancers. Okay, so the one should be very aware of all these new updates. Right. Ferroptosis now, this is defined as a new type of programmed cell death, okay, which occurs with iron dependence. Which of the following is not related to this type of cell death? Let's answer this question. Okay, so I am sure you will be knowing this now. Okay, morphologically, ferroptosis occurs mainly in the cells as reduced mitochondrial volume, increased membrane densities, decreased cristae. So yeah, definitely it decreases the cristae and causes membrane damage. So that's true. Intracellular glutathione levels becomes excessive. Wrong. Okay, so there is absence of glutathione peroxidase, so the intracellular glutathione levels decreases. Okay. Yes, apart from cancers, ferroptosis has been linked to acute kidney injury. So that's a very important point that you should remember. And yes, GPX4 is the most important molecule which is involved because it is glutathione peroxidase X4. So that's most important. So glutathione system is basically gone in this case. Okay, so that's ferroptosis. Let's go to the next question. So, an experimental study of NASH reveals that hepatocyte membrane injury with necrosis occurs due to increased amount of TNF. So, I hope everybody remembers TNF goes and activates TNF receptor 1, and along with that they have mentioned there is membrane damage. Okay, that is resembling the necrosis when the drug inhibiting caspases is inhibited. So they have given some drug which has inhibited caspase, so probably caspase 8 is inhibited, necrosis still occurs. Which of the following substances forms a complex that increases free reactive species? So which is the complex which is intermediate between these two? So everybody know it is receptor interacting protein kinases 1 and 3, and I hope you know that the recent update is about MLKL. Okay, so that is one very important update, okay, which I have just now discussed. Okay, so the answer here is D. So these are some of the important and tricky questions that can be given to you in your program cell. That's which everybody should be clear. I hope you will be able to remember these new updates and you will be able to answer superbly in exam.